Thank you for joining us today for the meeting of the New York City Health and Hospitals Board of Directors. Today's meeting is officially called to order. So for the record, please know Dr. Michelle Morse is representing Dr. Ashwin Vasan, Erin Kelly is representing the Deputy Mayor Ann Williams Isom, and Dr. William Fisher is representing Deepa Avila, and Karen Senhelier is representing Molly Wasser Park, all in a voting capacity. Also note for the record, Sally Hernandez Piñero is participating virtually in a listening capacity. So next on the agenda is the adoption of the minutes for the Board of Directors meeting held on January 25th, 2024. Are there any questions, comments, or changes? Hearing none, can I hear a motion to accept these minutes?
So moved.
All in favor, please say yes.
Yes.
Opposed, say no. So the motion carries. During the executive session, the board received and approved oral and written governing body submissions from NYC H&H Lincoln and Kings County. The board received and approved semi-annual governing body report written submission from NYC Health and Hospitals Queens. So let me move on to Vendex approvals. Since we began the process of approving contracts prior to Vendex approvals, there is one item on today's agenda requiring Vendex approval. That item has that approval. There are no items from previous board meetings pending Vendex approval. We will continue to notify the board as outstanding Vendex approvals are received. So let's move on to item number 6 in the resolutions. So Dr. Calamia.
Thank you. Authorizing New York City Health and Hospitals Corporation, the system, to execute agreements to create a pool of vendor contracts with each of the following vendors: Forerunner Technologies, Inc., Mason Technologies, Inc., Coronet Corporation and Interface Cable Assemblies and Services, ICAS, for the provision of cabling services on behalf of the system for an initial period of 3 years with 2 one-year renewal options exercisable at the discretion of the system for an amount not to exceed $85 million over the potential 5-year term, and to permit the system to add additional vendors to the pool should the need for additional vendors arise, and should such vendors meet the same minimum criteria and receive from an evaluation committee a score of 7.25 or greater. This was adopted at the MPA meeting to be brought to the full board for approval.
Thank you.
Okay, thank you. And thank you for the opportunity to present. I'm Kim Mendez. I'm the Senior Vice President and CIO, and I'm joined today with Jeff Lutz, who is our Chief Technology Officer. So the RFP was done to enter into pricing contract with cabling vendors to provide all labor, equipment, and materials necessary for structured cabling services and racked cabinet solutions in order to establish a network connection between devices and our local and wide area network systems throughout the enterprise. The contract will provide services for both project and support-based needs with a not to exceed of 85 million. Estimates are based on historical and known spend along with some projected programs and projects. This is aligned with a not to exceed amount of our previous contract that we had presented. The contracts will run for 3 years with a 2 one-year renewal option with a similar structure to the citywide contract. This replaces the existing contract due to Mason acquisition of G Systems and some limited participation of Coronet. We are also seeking, as a contingency, approval to allow additional vendors into the pool should the pool of 4 selected vendors become unable to meet our operational needs. And how will we do that? We can go to the next slide, please. That's a little different than the one I have. Okay, let's see. Okay. Oh, it's at the bottom. Okay, great. So in order to modify the vendor pool, a process similar to the standard procurement process that we followed will be followed. A solicitation will be posted to the city record. The same evaluation criteria will be used to score the proposals. An evaluation committee consistent with procurement policies will evaluate the proposals, and any vendor with a score above 7.25 will be selected. EITS will present the proposed award to CRC for CRC consideration, as well as we will also present and inform MNPA IT committee. I will also just add that this will not, the do not exceed stays the same. It doesn't increase any of the cost, that we're asking for. And our criteria is outlined here with the minimum experience of 5 years. I think a very important part is also the technical resources and the personnel must all be certified necessary to install the equipment. The financial capacity of 10 million, as well as MWBE utilization plan. Evaluation committee was members of OFD as well as EITS, and the substantive criteria is listed below. The next slide provides an overview of the procurement process and the timeline. And I won't read through all of it. I will bring your eye down to the evaluation committee was debriefed on 11/2/2023 and submitted the final scores, and 2 out of the 7 proposals did not meet the minimum criteria and were disqualified. Below are the top 4 proposers: Forerunner Technologies, Mason Technologies, CoraNet Corporation, and Interface Cable Assemblies and Services, also known as ICAS. Next slide, the vendor diversity. Here we can see that 2 of the vendors are 100% MWBE, and the other 2 have a 30% plan in place. The next slide is a review of each of the 3 current vendors who were selected performance, which were satisfactory or above, and then the 4th vendor who was new to us. We've actually done an evaluation process and, gone out and reviewed their references with positive feedback. Next slide. So IT, as we are requesting the authorization of New York City Health and Hospitals Corporation, the system, to execute agreements to create a pool of vendor contracts with each of the following vendors: Forerunner Technologies Incorporated, Mason Technologies, CoraNet Corporation, and the Interface Cable Assemblies and Services, ICAS, for the provision of cabling services on behalf of the system for initial period of 3 years with 2 one-year renewal options exercisable at the discretion of the system for an amount not to exceed 85 million over the potential 5-year term, and to permit the system to add additional vendors to the pool should the need for additional vendors arise, and should such vendors meet the same minimum criteria and receive from an evaluation committee a score of 2.7.25 or greater. Thank you.
Thank you so much. Any questions from board members? Rita?
Thank you for the presentation. I just a little bit confused under the second part for the automatic approval, or to be able to add additional vendors. So it sounds like you would still go through a process where they'd submit a proposal, you'd evaluate them, and they'd have to score and meet the minimum criteria, like a typical RFP process. So I'm not sure what are you.
So it is a contingency that we put in place so that we would not have to actually go through a full RFP process,
Okay.
but to be able to leverage the criteria of the current process to select vendors following the key components that we outlined, that we would actually review, have an evaluation committee, meet the same criteria as before, and it would not extend any of the requests, not to exceed amount of 85 million.
And where did the 7.25, is that what the kind of threshold cutoff was for this pool? Is
Yes.
that how you came up
Yes.
with 7.25?
So for maintaining consistency with the same criteria that we used for the current 4 vendors that were selected, it would be the same criteria if we move forward.
So
Sorry.
Oh, go ahead.
And then we added the element, for transparency, to bring it to CRC, as well as to bring it to MNPA IT committee for review and approval.
Okay, so it will still go through an approval process ultimately. So it really doesn't. I'm not sure what the additional authority.
The time
to add.
saving.
Oh,
and
to just removing the RFP process.
Yes.
Basically.
It's the front end process.
Yeah. The point I was concerned about was the transparency piece, not being able to see who the vendors are and.
Yes.
Okay, great. And then I had a question. Oh, well, actually, are you concerned about the vendor pool? Because I think you said you had 7 respondents and 2 were didn't meet the criteria.
Yeah, I'll have Jeff respond to that one.
No, yeah, it's a good question. So, no, they're groups that are constantly evolving. I mean, where a lot of where they were unable to meet the needs is that they're smaller, but some of the other partners that we do business with on a regular basis through buying equipment and the like are actually starting to add these services by acquiring some of these other people. So that pool is actually changing and enhancing all the time. So
Okay,
so right
it's
now
just
there
an
isn't a
evolving
concern.
landscape.
Yeah,
That's
it
good.
is.
Because it doesn't sound like you had many choices
Well,
otherwise.
no, exactly. That was kind of a bit of the concern, but that's part of what kind of led us to do this as well, because the two of the three merged together and really limited our pool. So, but no, it is something that is actually still growing, that's out there, type of thing. And we actually had, when I said on the previous one from the previous contract as well, and a couple of the same players, but we actually had a whole host of a different group that applied this time.
Yeah.
As well.
And
So-
I think we also learned the lesson, with Mason and G Systems, that we actually had 3 vendors before, and we ended up with 2 vendors and one who, that, did not participate as much as we would have liked. So this really is basically a contingency for us in case things do evolve in that direction, that we have an ability to not, decrease. We want to have a rapid turnaround so we don't lose time on projects, if we had to put a full RFP out.
Yeah. And then in terms of the pricing, are they, well, to your point, Kim, if there's 4 vendors, will you use all of them, or you may not? It just depends on what their
Project,
expertise
Yeah,
is.
we actually do a mini bid process for them. So when the project comes out, we will release that to these 4 vendors, and then they actually all bid based on that in alignment with their contract.
Right.
So.
Okay. Thank you.
Any other questions or comments? Okay, hearing none, let me then take it for a vote. All in favor, please say yes.
Yes.
Opposed, say no. So the resolution approved. Thank you so much.
Thank you very much.
Move to number 7 on your agenda. Calamia.
Thank you. Authorizing New York City Health and Hospitals Corporation, the system, to enter into the following 2 agreements with State University of New York Health Sciences Center at Brooklyn, also known as Downstate Health Services University, each to run through June 30th, 2028, for a total not to exceed $98,990,812, which includes a 10% contingency for the full term of both agreements. And these are the 2 separate agreements: a clinical affiliation agreement with services at New York City Health and Hospitals, Kings County, and New York City Health and Hospitals, South Brooklyn Health, for a not to exceed of $81,663,333, and an academic affiliation agreement for medical education and postgraduate medical training at NYC Health and Hospitals, Kings County, for a not to exceed $17,327,479. And these were presented directly to the board for approval.
Good afternoon. I'm Dr. Michelle Allen, Senior Vice President, Chief Medical Officer for the system. I have with me representatives from Kings County Hospital, as well as Andy Cohen, our General Counsel, the Senior Vice President.
Down the table.
Great. So, background, current state. In May 2023, the board approved an extension of the system's affiliation agreement with SUNY Downstate Health Sciences University through June 2026 to allow the parties to finalize new terms governing their continued clinical and academic affiliation. While to date the system's affiliation agreement with SUNY Downstate University Health System have combined the parties' academic and clinical relationship, the system has now negotiated the terms of 2 separate agreements with SUNY. One that will cover the parties' academic affiliation with H&H, Kings County, and one that will cover the provision of clinical services at both Kings County and South Brooklyn Health. The academic affiliation agreement and the clinical services agreement will both begin on July 1st, 2024, and will run concurrently through June 30th, 2028, and will supersede the terms of the system's current affiliation agreement with SUNY Downstate. For the terms of the agreements, the total cost is not to exceed $98,990,812, which includes a 10% contingency. Proposed agreements are being entered with SUNY as a negotiated acquisition, and that SUNY is especially well-positioned to continue the provision of the subject specialty services. The current clinical services agreement will be extended by 4 years to maintain the stability of the clinical partnership between New York City Health and Hospitals and SUNY Downstate Medical School. Kings County has 5 FTEs on the SUNY contract in emergency medicine, 8 in psychiatry, 23 in radiology, and 7 others. South Brooklyn currently has, on the SUNY agreement, 3 FTEs in the Department of Surgery. We will create a separate academic affiliation agreement to appropriately differentiate patient care needs from the academic operational cost. We also intend to strengthen the academic relationship between New York City Health and Hospitals and the SUNY Downstate Medical School. I'm going to turn it over for the financial analysis to our CFO from Kings County Hospital.
Good afternoon. Next slide. So this represents the financial impact of separating the contract. Some FY 22 through 24, when you look at the total expense, this is the current contract that's in place that has both agreements in one. For FY 25 through 28, as pointed out, we are now negotiating 2 separate contracts. So the costs that are in the clinical service represents those expenses related to the services that are provided at both Kings and South Brooklyn. And the academic expenses, which is the new column that you're seeing in FY 25 to 28, represents the academic expenses. But if you note, the total expenses from years 22 through 28 are not significantly different. So it's just a matter of allocating the cost to the appropriate contract. Next slide. So on this side, the first column that shows the proposed base costs are consistent with the previous slide, which excludes the 10% contingency. So the clinical services is the first piece, where you have the total cost of $74,239,393, and that's distributed 95% to the services provided at Kings and 5% for the services at South Brooklyn. With the 10% contingency, it takes the total cost not to exceed to $81,663,333. The second portion of the column is for the academic agreement, which is only at Kings. So it's $15,752,254. With the 10% contingency, it takes it to $17,327,479.
So we're coming to the board asking your approval, authorizing New York City Health and Hospitals Corporation to enter the following 2 agreements with the State University of New York Health Science Center at Brooklyn, also known as Downstate Health Sciences University, each to run through June 30th, 2028, for a total not to exceed of $98,990,812, which includes a 10% contingency for the full term of both agreements. A clinical affiliation agreement for the services at New York City Health and Hospitals, Kings County, and South Brooklyn Health for a not to exceed $81,663,333, and a separate academic affiliation agreement for medical education and postgraduate medical training at New York City Health and Hospitals, Kings County Hospital, not to exceed $17,327,479.
Any questions? Go ahead, Sally. I mean, Frida.
I'm
I was looking that-
channeling Sally.
I was looking that way.
Thank you and for the presentation, and thank you for breaking down the cost. That was very helpful. And Michelle, you may have said this, but what was the driver for separating the 2?
I'm going to defer to my general counsel.
Okay.
I think it was that when we looked to renegotiate the whole arrangement, we started to realize that there were really two different, very different functions that we were trying to, with different goals that we were trying to accomplish in terms of changes that we wanted to make, and it just, I think, sort of like strategically in negotiating it, it made sense to really be very clear which expenses were associated in which bucket and to make two distinct agreements that could, in theory, live on independently.
I mean, that sort of
They are
answers
same timeline. I mean, it is,
which is
yeah.
that there probably were different features in each that were relevant for clinical services versus GME that you wanted to address. So they do have different focuses, I would assume.
Yes.
Okay, thank you.
Thanks for the presentation. Just two questions. I was curious if you could say a little more about any differences in the clinical services for Kings County versus South Brooklyn Health. And then the second question was, since this original kind of agreement went through 2026, I was just curious if you could say anything about timing for renewing this agreement now.
So let me do the clinical first, and then you can do the timing. So the clinical is really, as stated on the slide that's labeled guiding principles, it's really minimal services at South Brooklyn. There are 3 surgeons, and that's it. Whereas at Kings County, we actually have a fair number of radiologists who are on the SUNY contract or agreement. And so there are more services at Kings County and more providers. Most of them are radiologists. Is that helpful, Michelle? And then the timing?
Historically, with these agreements, so SUNY has its physicians are unionized under a union actually that's different than the doctors union that represents most of the H&H and other affiliate employees, and they have a provision that requires them to give 1 year's notice if there's any chance of the loss of like our contract, for example, and therefore those people's jobs. So we have always been at least a year ahead of the potential actual termination date in order to avoid triggering something that might have people sort of fear risking their job when in fact that was not the intent at all. So we have regularly kind of been ahead by often about a year in terms of doing these renewals. And of course, the last time we came to you, we said that we did a short-term extension because we said we really wanted to separate out these contracts, and we just got the work done. Yeah, in time to avoid that trigger and bring it back to you.
Thank you. Anything else on this? Okay, so let me then take it for a vote. All in favor, please say yes.
Yes.
Opposed, say no. So resolution approved. Thank you so much. Move to item number 8, electing Sally Hernandez Piñero to a second term as chairperson and Frederick Covino as member of the Board of Directors of MetroPlus Health Plan, Inc., a public benefit corporation firm pursuant to Section 738520 of the Unconsolidated Laws of New York, to serve in such capacity for 5-year terms or until their successors have been duly elected and qualified, or as otherwise provided in the MetroPlus bylaws. And this is being presented directly to the board today. In the documentation, you can see a summary there with their qualifications. I mean, the only thing I'll say is that they're both, of course, highly qualified, and on top of it, we've had Sally is listening to us, so Sally has been a very
Hi, Sally.
very effective board chair for MetroPlus, and we're happy that she's willing to continue doing so, and thankful for her service.
Yes.
Any questions or comments on this?
Well, just to even
Yes.
out, well, first, I agree, Sally's been a great chair for us, and I know she and Talia have a great working relationship, so we really appreciate that, Sally. But also to say nice things about Fred, who was our deputy CFO for many years, and a true health and hospital person when he was the deputy CFO, he sat on this committee and was very helpful there. So sort of really it's returning him. And we always like to bring back health and hospital people because of their extensive knowledge of our system. So I think he'll be great to have back on this role.
Go ahead.
I just want to echo that because I think Fred has now had time to sleep. Fred was here when I joined the board and educated me on the cash flow situation for health and hospitals. So happy to have see him come back, and of course very happy to have Sally continuing as MetroPlus chair.
Okay, so let me then take it for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Okay, so the solution approved. So let's move now to the president's report, Dr. Katz.
Great. You have it in front of you, and I'm not going to read all of it. I'd like to just hit a couple of highlights that while all of the facilities celebrated Black History Month, I thought that what McKinney did was particularly special and creative, which is laying a wreath on the at the cemetery where their namesake, Dr. Susan Smith McKinney Stewart, who was the first African-American female doctor in New York State and the third in the nation, is buried. I thought that was a very fitting way to celebrate Black History Month. We got 9 awards for our commitment to high-quality palliative care. We continue to be part of the response for asylum seekers, but we are doing everything possible to work with the city on figuring out, now that we're past the crisis, where do things really belong. A lot of health and hospitals' involvement in this was there was a need for quick contracting, for quick servicing, unclear what the demand would be. Well, now we know what the demand is. We still have asylum seekers seeking services, but we also have people leaving the system. So there is a general better sense. We would like to begin moving things like contracts for leases to other parts of the city, and for health and hospitals to do what we do best, which is services. That's us. So we will continue to run the intake for asylum seekers, where there is an important role around disease control, which we do with our sister agency, the Department of Health and Mental Hygiene, for tuberculosis control, immunization, getting kids enrolled in school, health insurance, and also what we do at the other end, which is case management, to help people figure out what are the services they really need to gain permanency. Those are what I think of as the core things that would always make sense for health and hospitals to do. Holding leases, contracts for food, other kinds of services, I see those as something we did in an emergency, but that ideally we would not continue to do. DHS has taken some of the contracts for the smaller hotels, which we appreciate, and I think it makes sense. We're getting back to taking what is, I mean, I don't want to minimize. It's not that things have gotten easy. It's that things have stabilized at a difficult level. So at least while it's difficult, we all know what the challenge is in front of us. And so now the city has to have permanent solutions for caring for a large number of asylum seekers. We have more than 1,000 patients now who've been served by the Medical Respite Program, which we're very proud of. Castle Connolly was recognized as the Chief Women's Health Service Officer, and physicians from New York City Health and Hospital Harlem and Lincoln as 2024 top Black doctors. Our wonderful General Counsel, Andy Cohen, was noted for as among the most prominent 2024 General Counsels. Yes, we are very proud.
Yes.
We reached for New York City Care 125,000 members. And I have to say, whenever I'm in my clinic practice and I see NYC Care as the source of, how the patient is going to get cared for, I know they're not going to get any bills. I know that all of their medicines are going to be covered for a maximum of $2 per prescription. I know they have a number to call if they need help coordinating their services. So I think it's a very, very positive thing. Another Shiro in our midst, Dr. Michelle Allen, was named on the 2023 Black Powers list.
That was great. That was great.
I was very proud of her. Queens Hospital got a Da Vinci robot because it's become so much a part now of standard surgical procedures. If you have an opportunity, go on our intranet and look at our new homepage, which was just redone, and I was looking at it today. I thought it was, way more user-friendly than our previous homepage. For transparency, I want to provide a little bit of detail about emergency contracts. So an unfortunate occurrence, which was but not our fault or responsibility, is that every table which we had previously been in front of you with contracts for them to be a food vendor at Met Jacoby, Queens, South Brooklyn, and Harlem, basically left the East Coast, closed all their facilities. So
That was a really recent contract, right?
And it was.
I'm sorry, doctor, when did that happen?
it just happened like 2 months ago.
Wow.
But again, it had nothing to do with us. They sort of stopped on East Coast.
Approved that contract, what, 3 months ago, 4 months ago?
Recent.
They might have said something.
Again,
Not welcome back.
I don't know. And, as we note, they are contractually required to provide services, but, what can we do? They're not.
Had they actually opened? They had opened.
Yeah.
I think
So, okay, so I'm confused. So we contracted out?
We give them a license to operate in our facility.
Right.
And they just now say, we don't work in the Northeast anymore.
You watch them
Closed
carefully.
all of their locations. Again, it was not specific to us. So then, this was a huge problem because remember, we have people working, right? And if there's no food, if you didn't happen to pack your lunch, you didn't have time, you forgot, right? How are you going to work without any food? So that's why we did emergency licenses fortunately, you also approved a second license for a vendor called Tasty Picks. And they were willing to operate in the places where we lost every table. So let me just say this correctly. To operate, so just want to say correctly where Tasty Picks is now operating. Okay, so Metropolitan and Jacoby is where we have now permitted Tasty Picks to take up the locations where every table was operating. So in those two places, Jacoby and Metropolitan, we have now, as an emergency, said that Tasty Picks can operate so that there is food. And we are searching for a replacement for every table at Queens, South Brooklyn, and Harlem.
So, okay. I know we don't need to spend a lot of time on this, but I got to be clear. So who did they service? They wasn't servicing the patients.
No.
Okay, I just want to be clear.
Yes, this is not patient food, which comes.
It's the staff and.
Right, this is a vendor, right, for the staff, for families who are coming and
Okay.
staying,
Right.
for to see, someone's having surgery, someone's in the ICU.
Got it,
They need to eat. It's,
got it.
I think, we've had a historic problem, and the historic problem is usually places like this want foot traffic, but there's no foot traffic inside a hospital. So I'm guessing, although, this is not my business, that it's not easy to make a profit, because we don't seem to find it easy to keep contractors in this space. So it must not be, I'm gonna suggest, it seems like there should be some sort of community kind of nonprofit food kind of person who, right, maybe we have been approaching this in the wrong way. Maybe there is a different type, right, of food deliverer. Because it seems like someone, right, I mean, trucks do it, right? Trucks park and people partake.
That's interesting.
So I feel some part of this model we have wrong. So we'll see what we can do to see if there's just a different way to look at who provides the food. I know I've heard people talk about how the prices at the food trucks are less expensive than the prices at our vendors inside.
They don't have the infrastructure.
I guess.
So if
But we
I
don't
may,
charge, I mean, it's not like we're gouging anyone for the infrastructure.
Staff. I mean, there's only 1 or 2 people in a food truck.
so
Why can't we have the equivalent of a food truck inside?
2 trucks inside,
Interesting.
interesting.
More food trucks out
Yes,
in
That's pretty
parking
cool.
areas or certain of the hospital.
it should, I want to try to figure out a better solution, because this, I mean, again, if you, historically, right, remember we used to have Moonstruck at Bellevue, which no longer operates. So we have not succeeded in keeping vendors, despite the fact that we're not charging high rates.
You're
them
really
to
not,
use it.
A lot
No.
of the food was very inexpensive at Harlem Hospital cafeteria, but they done changed hands about 3 or 4 times. So yeah, for the cafeteria. So a lot is not expensive. So maybe,
There's a
maybe
different
that's it.
way
But
to do it.
that's something to think about, because people do need some food while they waiting. It's so
Absolutely.
many hours. Yeah.
Absolutely.
Yeah.
And the other one is I approved an extension to certain contracts that the board had already approved in the past, but where we're undergoing an RFP process, and we needed to ensure continuity of these critical patient care services. So this is for our interpretation services, extending by 8 months the following vendor contracts for over-the-phone interpreter services with a not-to-exceed amount of $15 million for Linguistica International, Propio Language Services, and Language Line Services, Inc., and extending by 4 months the following vendor contracts for video remote interpretation services for a not-to-exceed amount of $3 million, AMN Healthcare Services, Inc., and Language Line Services, Inc. And again, these are contracts, as a board, you already approved. I'm just approving extending them until the RFP is done so that we don't run out of services.
Did we cover all essential languages?
Cover all essential languages.
Thank you.
Thank you, Dr. Katz. Any questions for Dr. Katz or comments? Okay, thank you so
Okay,
much.
thank you.
The committee and subsidiary reports, the committee reports were emailed to you and are in your folders for your review and submission into the record. Are there any questions or comments about those reports? Is there any old or new business to come before this board? Hearing none, the board meeting is adjourned. Thank you.
Thank you.
This meeting is no longer being recorded.